Hello, my name is Joe Lipton. I'm one of the consultant anaesthetists that works with Mr. Gordon, and today I'm going to tell you a little bit about what you can expect from your anaesthetic when you come for your surgery. The first thing that happens when you arrive at the hospital is that you'll be ushered into one of the rooms, checked in by one of the nursing staff, and at that stage I or one of the other anaesthetic doctors that works with Mr. Gordon will come and visit you and talk to you about the anaesthetic that you can expect. We'll find out a little bit of your background medical history and whether you've had previous anaesthetics in the past, and then spend some time talking about the anaesthetic plan for the day. The vast majority of patients having surgery with Mr. Gordon have these done under ankle block with some sedation. So what I'll do now is just explain to you what to expect from that whole process, what it will be like when you're having the ankle block performed, what can you expect during the operation, and what it will be like when you go to recovery and thereafter. When you come downstairs to the anaesthetic room, the first thing that will happen is that we'll check you in, check your identity and your consent form one final time. Somebody like me will put in a cannula into one of your veins, will give you some oxygen to breathe through a face mask and connect you to some routine monitoring. At that stage we'll initiate some sedation. This may be a little bit of light sedation or something a little bit deeper, and the ankle block will then be performed. We do this using an ultrasound scanner to locate the 5 nerves that surround the ankle and supply sensation to the foot. That's 5 separate injections on one or both sides depending on what kind of operation you're having and whether it's on both feet or not. The procedure itself may be a little uncomfortable, but it shouldn't be painful and most people tolerate it very well. Each ankle takes between 5 and 10 minutes to block, and then over the ensuing 5 or 10 minutes the foot will become numb and the sensation will change gradually over that time. What we'll do before we move into the operating theatre is we'll use a cold spray on your foot to test that the block is working effectively. This enables us to assess whether the nerves are effectively blocked. Once we're happy with that, we'll then move into the operating theatre. It's the ankle block that provides the anaesthesia for surgery, and the sedation is really for your comfort, and that means we can tailor it to exactly what you'd like. Some people prefer to be wide awake or very lightly sedated during the procedure, and others would prefer not to be aware of anything at all and to be much more deeply sedated. All of those are options, and we can discuss with you what your preferences are. What will happen during surgery is that you'll be kept warm and comfortable and monitored in the operating theatre. Somebody like me or one of my other anaesthetic colleagues will be present throughout the operation and therefore able to respond to anything which happens if there's any discomfort or we needed to provide any additional support for any other reason. At the end of the operation, we'll stop any sedation that is running. You will be awake by the time you get to recovery, and you'll feel quite close to normal within the first 30 to 60 minutes after your procedure. If there are any problems with postoperative pain, they will be immediately addressed. And we can then go ahead and talk about your postoperative pain management. We'll prescribe postoperative pain relief for you to take home and give you some detailed instructions on the day of surgery as to exactly what to take and when, to make sure that you have a comfortable postoperative period.